welcome to my channel. My name is Priscilla and I'm a nurse. On this channel, we believe you are never too young to reach your full potential. And today we're talking about remote nursing and the different positions that you can have the opportunity to do whilst being a nurse in the remote position. Without any further ado, let's get started. On this channel, we believe you are never too young to reach your full potential. So today, I have a couple of jobs for you guys. If you're wanting to get these nursing positions, do your job, stay at home, benefit from being with your children, dog moms out there, being with your dogs, being just in the home space, because being at the bedside can be very, very taxing. And just COVID regulations, everything that's going on right now, things are just really up in the air. And with our current legislation, it's just a lot of things are going on in nursing. And if you can have the options of being at home with your family, and if that's what you want, that is completely awesome. But here are some options and things that you can do working from home. Let's get started. So a lot of things that I've been seeing in the work from home field is the remote nurse reviewer. So you're essentially working on documents, and if an insurance company hires you, you're reviewing documents, whether it can be prior authorization reviewer, legal documents if you're in that field, but it has to do with the medical aspect of nursing. So that is the number one that I've been seeing around, the nurse reviewer. So number two is the patient support nurse. So as a patient support nurse, you are caring for the patients, usually virtually, supporting the patient through a telehealth visit, or if you guys have heard of companies like Nurex or companies that do telehealth, you're supporting that company by reaching out to the patient and either texting them, calling them, seeing if they can fill out these questionnaire. You're supporting the patient through the process of the telemedicine, through telemedicine essentially. And it can be on an app, it can be live in person, and the patient could be on the app or in person. So that is where you are supporting the patient. Number three is the telehealth nurse. So telehealth nurse, you're working with a patient through their telehealth experience. Number four, call center. So you are doing triage care. And next is the prior authorization nurse. Prior authorization is a very, very strenuous process, because I have personally done a prior authorization, and it has taken literally a week at times just to prior authorize either a medication or a procedure that a patient needs to get done. So prior authorization is something that can be very, very time consuming. Talking to patient, doctors, insurance companies, and that in itself can be its own little job. And I can't believe I was doing that with my other job, fighting with insurance companies about medications and procedures that need to be done. Prior authorization is something that is essential, especially in this day and age, because if you are wanting a certain procedure that needs to get done, whether it's a CT scan or it's something in the outpatient setting, your insurance needs to clear that before you can even go, or you'll get a very, very large bill. And the prior authorization nurse is the middleman that is working and getting all of that stuff figured out, talking to the docs, getting signatures, getting things faxed and scanned. So this is a very important job, and I can guarantee you that you will be working. I can guarantee you that that's a very, very it's very important. And my last job is a case manager. Case manager nurses manage cases, whether it is a chronic or an acute case. It's usually chronic. And I've also seen case managers call patients that are have gone home from a hospital, see how they're doing, following up, make sure they're following up with their labs and following up with clinic. Case managers are the link between the hospital and clinic, the hospitals and the patients, and the hospital and other organizations that are there to better the patient in their care. So case managers are very, very important in that aspect. Definitely a job where you're having that one-on-one communication with your patient, the patient's family, and or the organization that you represent to better their life and to better their outcome. Whether it's a hospital stay or hospice care, case management is very, very important. So these are the jobs that you can do remotely as a nurse, just so that you are aware. There's many other opportunities out there to work as a nurse from home. Obviously, I can't cover all of that in this video, but there are more videos to come about remote nursing positions and opportunities. If you guys have any questions, please leave them in the comment below. Please like, comment, and subscribe. Have an awesome day. Bye.